Thank you. If you have questions, please put your name tags up or raise your hand, and we'll start with Arturo. And then we'll go to Vicky.
Thank you both, and congratulations for such excellent work being done in the field. I wanted to throw this at you, Tom, because you are mentioning evidence-based solutions, and you are focusing on the most important, as you say, homicide and trying to reduce it. And I would ask, why not look at the north-south effect of arms trafficking in a deeper way? Because we seem to be looking at the causes of a phenomena that for generations has impacted the Northern Triangle, with U.S. policies having a direct impact on the flow of ammunition and guns illegally to those countries. Why not put that into the equation and look at policies from afar that can affect and destroy nations for generations?
Thank you. I'm going to take a couple questions. Vicky, would you like to go next?
Thanks. Hi. Thank you for your very thought-provoking presentations. Lots to think about. I'm the director for the Office of Gender Equality and Women's Empowerment at USAID. Aubrey, for you, I was curious in terms of your indices index. Do you look at, like, in terms of stability or peace, how educational levels or gender-based violence, other inequalities between maybe different religious group or ethnic groups, poverty levels may influence the index? I didn't see all of your stats there. And then, Thomas, could you talk a little bit more about just your thought, the tertiary and secondary prevention versus primary? I'd just like to know a little bit more your thoughts on that, what you were alluding to in your talks. Thanks.
Okay, one more. Jackie, if you could question, then we'll go for a second round because I'm sure we'll have very brief answers.
Well, I would like to second that question in terms of gender inequities with the peace index, because there's several measures of that. And also racial ethnic group inequities, because I think that really, especially, we're very cognizant of that in the United States, and a lot of places say, well, we don't have anything like, that. And I'm like, yes, but you have marginalized groups in your societies also. But I'm also, in terms of the learning communities, as you folks go forward on that, Tom, I'm hoping that those three learning communities will learn from each other, because there are certainly overlapping risk and protective factors. And I am absolutely fascinated with a lot of what your group is doing. I really like the notion that not meta-analyses, but reviews of research include qualitative data as well as quantitative, and integrate the learnings from those two. And I would like to see some standards for reviews of research that talk about how to do that, because there's lots of standards on how you do a meta-analysis and lots of standards on, how you look at qualitative data, but to integrate those learnings is very challenging, and I try and teach my students to do that, and they find it an overwhelming challenge. Where's the book on that? Where's the guidance? And then the other thing is, because I come to violence prevention through homicide of women, and I understand your thing in terms of home violence, that and oftentimes homicide of women is intimate partner homicide. And we conducted a review 2 years ago now, it was published, on how homicide of women has different dynamics, and that so often when we present, when reviews are done of homicide, it's, well, there was so many homicides of women and so many homicides of men, and after that, everything is aggravated. Rather than disaggregated, it's aggregated, so that conclusions about risk factors are for the whole, which is driven by the risk factors for men. And we also had a terrible time getting accurate counts of homicide of women in many of the countries of the world. And I wondered if you've gotten further on that.
Okay, so I'm hearing a range of questions around stability, looking at other inequalities and equities in terms of the index specifically, but more broadly, also about tertiary, secondary and tertiary interventions and analysis and interventions, and then something about the U.S. policy. So I'm wondering, or the impact of lack of policy on other countries. So maybe we could start with Aubrey.
Yeah, just to take Vicky and Jacqueline's question together for a moment. So some of the things you pointed out about acceptance of the rights of others and intergroup cohesion stand out very strongly in our positive peace analysis. And what's interesting about that is that because we have access to so much data, when we did the analysis, what we said is of the over 8,000 data sets that we've collected, when you drill down, which 8 factors appear to drive peace most in the long term. So we didn't start with an identification of the issues and then fit that to the model. We went the opposite way. And one of the 8 factors that stands out really strongly is one that we collectively know as the acceptance of the rights of others. And those include very particular data sources around intergroup cohesion, which refers to cooperation of identity groups within a society, and gender inequality, right? So measuring women's disadvantage in reproductive health, empowerment in the labor market. So if you look at those data sources, those have a very tight fit to our positive peace model. If you go to negative peace, which again is more of a snapshot of where peace stands at any one given moment, we do not have a separate gender-based violence indicator. It's not because we don't want one, it's because at this moment in time, the data is not collected very well and it's not very comparable across nations. So a lot of that data is baked into other indicators that we use, but ideally we'd be able to pull it out and take a closer look at it. We're just not there yet.
So first to Arturo's question, which is an excellent question. There really sort of respond in 2 parts. First, the reason we don't talk about firearms the way, although we do go into firearms in the report, but we don't talk about it in the way that you mentioned, is a limitation or a decision about the methodology of the study. The study is looking at rigorous evidence. And rigorous evidence has a very strong programmatic bias, meaning the only thing that generates rigorous evidence, causal evidence, are studies of small individual programs. And so it's something that we need to keep in mind when we talk about the evidence-informed or evidence-based revolution. We're really only talking about one slice of policy, which is programs. And so thank you for bringing that out. That's very important. However, I do want to say that, I'm familiar with this issue, and I have to say I'm frustrated with the national conversation that we have in this country, particularly on guns, but elsewhere as well, which is the conversation is generally highly generalized. It's about all guns, and there are no distinctions made. And we are sort of at impasse in this country, which I think is a terrible shame, but it's where we are, at impasse about sort of what to do about all guns. However, the research that we see is that overwhelmingly, the guns that matter most are, highly concentrated in certain places with certain people around certain behaviors. The gun you need to worry about is the gun that is in the hands of a young man on a Saturday night when he's with his friends and he's drunk and he runs into another group that they don't like. And so so one of the things we don't talk about is we don't talk about how do we limit guns in those problem places around those problem people more. And a lot of those efforts don't require a ton of money and they don't require new laws. So something to think about. Vicky, in terms of your question, it's a great question. One thing is that we talk about in the report, we're very transparent. The fact that we chose systematic reviews creates a bias in that the, primary prevention programs are generally, there's not that many that are studying the outcomes of crime, victimization, and homicide that we were looking at. They often talk about things like aggression, or sort of, or fights, or these types of things. But they're not measuring sort of formally reported crimes, which is what we were looking at. And the ones that do are so expensive to do, there's not that many of them and not enough to put into a systematic review. So I think the conclusion of the report is we need to be spending a lot more time on secondary and tertiary. It's not to the exclusion of primary, but we're underemphasizing primary and tertiary. And then, Jackie, I completely agree about mixed methods. I mean, one of the things is it's just sort of a quality and common sense check that you've got to get out of the office and actually, get face-to-face with people and see what you're studying and measuring. And then the other is, the interrelationship between different forms of violence, particularly gender and domestic violence and community violence, is really important. It's not well understood. I think it's clear that preventing exposure to violence, I had a great conversation with Mayor Guerrero about this earlier, early in life is going to lead to less violence later. But I also would just say, I think it may be an open question about whether domestic violence follows a dramatically different pattern. So community violence follows not a normal distribution, but a power distribution. And David Kennedy and others are starting to say that it is that small group of highly violent people who are actually much more likely to commit the most serious acts of domestic violence. So it's...
And we don't find that, but...
Okay. And I'm not an expert on that, so I won't argue that further.
Okay, we have Elizabeth and then Rodrigo. And then my colleague in the back.
Yeah. Thanks. I wanted to ask Aubrey, what's the role of victimization surveys in your databases? And since you take the focus of peace, could we potentially change the type of output and look at it in the way you do, which is negative and positive peace, and use it so that it is more accessible in terms of its usage? Because a lot of money in many countries is being spent by a lot of development agencies to do these surveys, and the impact is often very low, except in driving fear. It just, focuses on the victimization. So that's one. And Thomas, I was going to ask you, in the meta-analysis, what could you kind of identify what percentage of your studies actually came from the South and from non-English speaking countries? Because I've worked with many groups that have looked at the meta-analysis, and they come up with the same conclusions, that there's no evidence in the South. But maybe you were able to go further and deeper. The other thing, which is more of a comment than a question, and something that I think we have over time, I agree with you, the statistics really do say that if you focus on the most affected areas, you're going to have the greatest impact on that. And I'm all for that. But at the same time, violence occurs along a continuum, and it's a very complicated process that is involved. And what we found, and I'm seeing it now in our citizens and security programs, where they're shifting all their staff members from being field workers, programmatic workers, to working with these highly concentrated, very volatile groups. And they don't have the skill set, they don't have the ability, they are not having, I don't have the data, but I'm just feeling they're not having the impact. You need to make sure that the skill sets of the persons you are using are matching the needs of the population you are trying to make a change in. And because and at the same time, while primary prevention might not be the cost benefits of how much it costs to reduce that hardcore, the benefits are huge. But the cost benefits, you can't overlook the overall cost benefits of wide-scale primary prevention, which most people can get involved in. Most healthcare workers, most cops, most social workers can do primary prevention. Some of them can do secondary prevention. But we have to be careful about how, when we're focusing on that tertiary prevention, especially group, it's very culturally appropriate. I don't think what works in Jamaica necessarily works that well in Colombia. I don't necessarily think it's the same thing in exact drivers in Chicago. And then you get a mixture with organized crime infiltrating into that group very easily in and out. And nowadays you're talking about terrorism infiltrating it. So
Thank you, Elizabeth. I'm going to ask us to go into
Sorry.
another question so we can get them into the record, my dear friend. And if we could keep our questions short so we can get them onto the record. Rodrigo, please.
Okay, thank you. Well, mine is more it's a general comment. First of all, listening to Audrey and Thomas, as we say in Spanish, was música celestial, heavenly music, because there's no question that unless you quantify, you measure, you cannot progress. And I see the benefits of all those two efforts. But I have spent my life on that, and I'm going to make some comment from that point of view. First, most of the time, you are referring to secondary data. I would say all of the time. And secondary data tend to be poor, unreliable. And so you have to interpret with caution these things that happen. Political considerations tend to obscure homicide data. We have seen that all over. So what we have, I myself, the first time I was mayor, I noticed that the police, you define homicide, those killed in the streets. Those dying 2 or 3 days after, they invented a very nice word, disease. They were not homicides because they died. They were not dying in the streets. So decesos. So it's all over. I've had known countries in which homicide, it's only counted when they begin the criminal investigations. So 10% of the violent deaths are only homicide. The rest are waiting for a definition. Because of that, we have done two things which I believe it will be very good. First, we developed in Cali and then in Colombia and many countries now, cities of Colombia and other countries, what we call observatories of crime, which are periodical meetings of the interested parties, police, forensic medicine, academics, which are very good because they are independent. They are not, and they meet regularly and they produce data. Those data are highly reliable. We have in Cali for the last 20 years, these people meeting weekly. So when homicide in Cali is perfectly homicide. But then the definition of homicide changes from one country to another. And we have, for example, the case of Honduras. You look at for 2011, OAS data was 33 per 100,000. UNDP data was 66 per 100,000. And they were for the same country at the same time by very respectable institutions. Because of that, we, with support of the IDB, began a project to standardize the definitions and the way of collecting crime data. And it has been published. I will give you the reference, unfortunately, in Spanish, in the Revista Panamericana de Salud Pública, in which we have selected 18 crime indicators. And we have 20 countries that have agreed to use that definition and agreed on the way to collect data so that we have comparable data. So this is to mean that they support the effort they are doing and to tell them that we have to improve still more the quality of the data because otherwise we will be taking decisions based on shaky, unreliable data. Thank you.
Thank you very much. Peggy, your question, and our colleague in the back.
I'll be
And we might not
quick.
have time to answer, but I'd like to get them out. Thanks.
Okay, this is for Thomas, but when you talk about funders needing to be, requiring good evaluation of programs, I think it's important to to look at how it's expensive. I think we could do better at leveraging some research funds in partnership with community programs. We've had examples of that at NIH in the past. People believe that NIH doesn't fund program evaluation, but we have. And we've done it when we've partnered universities together with community, I'll say, organizations that are doing, college drinking is our best example, where we required the applications coming in to be a partnership between a community, the college campus community that was preventing excessive drinking with the university-based researchers, and it worked really well because it's what I call program evaluation plus. So it's evaluation of that particular program, but it also added to our general knowledge about how to prevent a problem. And I think it's important, and having a university-based person or someone who's really aware of the larger literature and how this particular program will add to our knowledge of the larger literature is important. I want to thank you for mentioning alcohol, because it's not just alcoholism, which is often what I hear. It's not just the need for more treatment programs. It's policies that we know work to reduce the availability of alcohol, and that's critical. And those things can be done. I keep saying they can be done tomorrow with what we have now, and it just isn't happening. And then also, thanks for mentioning mixed methods, because NIH does fund mixed methods research, and we fund training on it, and we'd like to see more of that happen.
As brief as you can, please.
Yes, just a suggestion regarding one of your assertions, Tom, in regards to secondary and tertiary prevention and the difficulties with primary prevention. One thing that I would suggest, and that you mentioned as a caveat, is a methodological caveat, is primary prevention by definition, doesn't want to see any of the outcomes that, if you have effective primary prevention, you don't see any of the outcomes that you're talking about. Yet publication of evidence focuses more on the negative outcomes, and so there's a discrepancy there in terms of the publication of bad outcomes versus the absence of those outcomes that might be because of effective primary prevention. So there's difficulty in measuring that. The temporality might be longer in some cases when you do primary prevention, at least more difficult to measure. And just a suggestion to mention that a possibility or a possible reason for that lack of evidence, it might be also methodological or a bias in publication maybe.
Thank you. I'm going to take moderator prerogative, and we have so many questions, so much I'm sure you want to say. I'm going to ask you just to take a final minute to perhaps not respond necessarily to the questions, but to capture what you'd like to go on the record as your final thoughts.
Wow, that's a heavy responsibility. My final thoughts. I actually did want to respond to some of the comments that I heard. I thought Mayor Guerrero and Elizabeth asked sort of a similar question, which I think is very interesting. We do a Mexico Peace Index. We recently released the 3rd edition, and we faced some very almost existential questions about the reliability of our our index based on homicide, which is one of the big indicators in the Mexico Peace Index. And what we did was, we used 3 different sources of data on homicide. So we had official government data, police data, essentially, hospitalization data, and victimization data, going back to this theme of using victimization. And it helped us a lot because we were able to show discrepancies between these 3 data sources and on a state level. And you find, interestingly enough, that there are some states where the police, for example, might only report as a homicide 60% of homicides reported by hospitals. And so we were able to actually shine a spotlight on particular states in Mexico where there were particularly egregious data gaps, and start this conversation about the need to improve data. And in a way to inoculate ourselves against a legitimate question, which is, well, gosh, can we even trust the data you're using to report in the index? And then just one final comment about positive peace. A lot of interest in that topic, and how do you build more momentum around the idea. And I think we're at very early days. So part of it is giving people a vocabulary to start talking about positive peace. But we have also started to do some interesting interventions. So we've done positive peace workshops in Zimbabwe and in Uganda, where we gather people together, various stakeholders, to talk about the factors and what they can do to improve them. We're trying to build kind of the brand of positive peace, because I think that has important implications. But yes, it's a long process, and it will take a while to really shift people's mindsets.
So I will go around individually to each of you about your questions. But just a sort of broad thought about this type of work and the responsibilities that we have. We're all thought leaders in this room, individually and collectively. And two important components, I'm sure there are many, of leadership are synthesis and emphasis. Synthesis meaning explaining to broader audiences how things fit together. And then emphasis meaning selecting particular things out of a myriad of factors and solutions and all of those things, which are more important than others. And it is very important that we do the hard work of not just assembling all the evidence, but then synthesizing it and then emphasizing the most important findings.
Thank you so very much. Obviously, we all found this an incredibly wonderful way to start our morning. And we covered a lot of territory. I hear again in every panel that geography really does matter, but that we've heard examples of how we can not only leverage existing information and funding, hopefully, but also how we can build collaborations to really address some of these challenging issues. And I think when we come back again to look at this, our panel for the next time around is, what is implementation and how do we know if we've gotten there with the SDGs? But for now, I just want to remind us, I heard two exciting things. The Institute is developing an independent measure, and I look forward to seeing that. And in November, the flagship report of no violence will be issued, so we can look for that as also really some interesting guidance information. So thank you so much, and we have a 10-minute break.